One of the main reasons people see a chiropractor, any chiropractor, not just us, is for low back pain, and the second reason is because of neck pain and headaches. At Platinum Chiropractic, we do focus on neurostructural correction, so we realize that structure plays a really important role in your overall health. So if your spine is functioning the way that it should, everything is in alignment, that's going to allow the nerves to go to every single area of the body, not just your low back. So one of the main things that we see a dramatic improvement with is acid reflux, again, headaches, constipation, in ladies, helping with cramping during their cycles. So just a lot of different things, not just for back pain. I think probably one of the biggest things that people are hesitant of, and unfortunately the internet does not help with this, is neck adjustments. Because I think I've seen a million different types of very violent neck adjustments. While I can never ever give the claim that it would never be painful, because that's such a subjective term for so many people, we do have a variety of different methods for adjusting the neck, as well as the rest of the spine, so that we can put the least amount of pressure into the area. We do a lot of manual adjustments, but we also have a handheld tool that we use for some people as well. All right, I'm not gonna say what grinds my gears, but when I think probably I always kind of giggle and laugh a little bit when I have a new patient come into the office and they actually manually adjust their neck in front of me. Don't do that. But the main reason I say that is because when you adjust your own neck, you're just providing a complete, like, just full range of motion. It's not specific at all. And you're just releasing pressure, right? Which is why people do it to themselves. But like I just said, it's not specific. And so for us, again, with our exam, with all of the things that we do, we want to be as specific as possible, because if you adjust your own neck, and for example, if I say like this spot is the one that's stuck and you manually adjust your neck, it could be adjusting the ones above it, below it, but this one could still be stuck. And so what ends up happening is you create hypermobility in those areas and there's still an issue, right? So that's why you continually keep doing it yourself. But again, being a little bit more specific, a lot more specific with what we do really can make a big difference. Well, as many of you know, I am certified in pediatrics, so chiropractic definitely is not for just adults. And I think that was one of the main areas for me that really kind of took a turn. I mean, in school, I was a rugby player and I really thought I wanted to do sports chiropractic and help athletes. And of course, it was after I became pregnant, had my own children, that I said, ooh, wait, there's a lot of things that we can help with. And so that's when we both went and took the coursework for pediatric certification. So with pediatrics, it's definitely a lot different in terms of the type of adjusting that we do, but it can help with so many things. I think probably the biggest one that has probably been researched the most is actually ear infections. Because with chiropractic care, there's about an 80% success rate with adjustments for ear infections, as opposed to, if you actually do the research, it's about 20% with antibiotics. So really, I mean, there's so many different things that we can help with, and we'd love to discuss it with you. If you just want to give us a call and we can sit down and talk. I think probably the biggest thing that we see a lot with just different types of chiropractic offices is we often hear it, well, come back when you feel like you need to, or I don't feel like I need to, so I'm good. The biggest thing that we really see in the office, like I said, with that neurostructural correction, is really focusing on maintaining structure so that your body functions the best that it can. So the thing that I probably love the most is that the majority of our patients actually are pain-free when they're coming in to get adjusted regularly, right? And regularly is different for everyone, but I just love the fact that they are aware that the adjustment is not just helping with pain, but for some people it helps them sleep. For some people it helps them concentrate a little bit better. There's so many different benefits to getting adjusted regularly outside of pain. And so, yeah, no, definitely not just for pain, but just for making sure that your body continues to function the way that it should.